I'm a health, science, and disability news nerd, and these were some stories that caught my attention this week. Donald Trump has taken the office of the presidency and is starting to wreak havoc on the United States healthcare system as well as its federal agencies. Health and Human Services and all of the agencies that are underneath it have been barred from speaking to the public. While this is not necessarily an unusual occurrence when there is a change in the president, it comes at a not great time. The CDC had to cancel an external meeting between federal and state that was supposed to happen in regards to H5N1 because of this freeze. It is supposed to be lifted on February 1st, but who knows? Who knows? Trump also signed an executive order withdrawing the United States from the World Health Organization. Removing the United States from the World Health Organization poses a huge risk to public health. In a comment published by multiple physicians within the Lancet, they state that U.S. Congress, the courts, and the public all have the power to block this reckless decision because the USA entered the World Health Organization membership through a 1948 joint resolution, which was passed by both houses of Congress, and the president's executive orders cannot surpass law. And when did these doctors publish this article in the Lancet? August 1st, 2020, because Donald Trump did this in his last presidency. So if there's any way that we can potentially keep the US in the WHO, it would be the best for public health. So maybe we should contact our representatives. And finally, on an earnings call last week, the United Healthcare CEO says US healthcare system needs to function better. He added that a variety of state, federal, and private sector structures and programs have created a confusing, complex, and costly healthcare landscape. He discussed some of the shortcomings of the profit-driven model of US healthcare and said that while lower prices can improve services and be good for consumers and patients, they can also threaten revenue streams for organizations that depend on charging more for care. But he didn't discuss to what extent United Healthcare itself was a beneficiary of such circumstances. United Healthcare's fourth quarter was worse than expected, and the CEO went on to say that healthcare in every country is complex and the solutions are not simple, but you should expect this company to continue to work at it. All right, United Healthcare, show us what you got then. So what other stories did I miss this week? Tell me in the comments below, and I'll see you next week.